I still have it. And I wanted to use it. And then I got to work. So I have him not to say that I couldn't have done it, and then I passed on.
So, we have more of all our members, or do they really not have that?
Hey, this is Kayla. Hi.
No, it's
Oh, yes. I think it's a weird.
I should get it.
No.
Yeah.
Okay, good afternoon, everyone. I just cannot believe this. Welcome to the 7th meeting of the Macoupin and Montgomery County ROSC. How can it be 7 months down the road already? So I'm glad to see everyone. My name is Brian Polo. I am one of the ROSC coordinators, and I am a person with lived experience. I'm grateful to be with you all today, and we have a pretty full agenda. I would like to start real quick by introducing my new partner. This is Jennifer Karen. She is my new teammate. She's the other ROSC coordinator. Has a extensive background in law, I guess, type stuff. And she's been on the job about a week and a half. And she's already rocking it, making new connections for us all. I'd like to go ahead real quick and start introductions, and I'll start around the room first, and then we'll go online, and I would like to start with John.
John Blank, owner of Shelter Insurance Agency here in Litchfield.
I'm Karen Webb. I'm the Emergency Department and Surgical Services Manager here at St. Francis.
I'm Kayla Waite. I work in the EBS department and also in my graduate year of psychology.
David Knoblich, Administrator of Hearts United Association of Litchfield, as well as Vice President of the Litchfield Ministerial Alliance. Or actually, treasurer. Yeah.
We'll give you the other titles.
No.
John Magnuson, Litchfield Ministerial Alliance, pastor in town and business owner, and a whole bunch of other stuff.
Candy Mazza, I'm the Family Engagement Coordinator, the Homeless Liaison, and the Foster Liaison for Litchfield Schools.
Lindsay Miner. I am Recovery Care Coordinator for Macoupin and Montgomery counties, and I also run the Safe Passage program with Elise.
Yep. Elise Schoen, and she introduced me. We're an unbreakable bond.
Yeah.
Sam Claxton. I'm in drug court, and I'm here to learn more.
Erica Fetcher, I'm the ROSC. I'm going to school to be a certified recovery support specialist, and I'm a recovering addict.
Heather Thompson, I'm a recovering addict, and
Kent Terrell, Director of Macoupin County Health Department.
Kevin Schott, Director of Montgomery County Emergency Management Agency and Chair of our County Community Risk Reduction Committee.
Dan Huff, President of the 708 Board.
And my assistant.
And assistant Kevin and other hats.
Maria Clark, I'm the Hillsborough Area Hospital Project Manager, and I also sit on the 708 Board.
Pete Rippercord, I'm an MSW student, and I also am in long-term recovery.
Chris Smith, I'm Executive Director of NAMI of Southwestern Illinois.
I'm Dawn Young. I'm a nurse practitioner with Springfield Clinic in Hillsborough, and I'm also the Secretary of Crossover Ministries.
I'm Kathy Alford. I am a FSS with Maple Street.
I'm Becky Hatley, and I have a new title as of today, so I have to look at it. Assistant Director of Clinical Services for Montgomery County Public Health Department.
And I already had my introduction. But I am Jennifer Karen. I am Brian's partner. I'm the new ROSC coordinator.
Oh, and then there's me. I'm writing everybody's name down. I'm Carissa. I am faculty over at St. Louis University, and I am data coordinator on the RCOR project.
Okay, and I think we all know Julia, but that's who I see near the top of the screen. So Julia, if you want to do a quick introduction, and then we'll work our way across the room.
Hi, everyone. My name is Julia. I'm a research assistant at St. Louis University, and I'm a project coordinator on the RCOR grant.
Okay, thank you. Nancy? You're muted.
I know. I thought I was going to sneak in here and just observe. I'm Nancy Phillips, and I am your ROSC coach.
Okay, very good. Ovia?
I'm Ovia. I'm an MSW practicum student at Macoupin County Public Health Department.
Okay. Crystal?
Good afternoon, everyone. I'm Crystal, and I'm another MSW student here, interning with Macoupin County Public Health, WashU student. Nice to meet everyone.
Okay. Let me go through here. Oh, Donna, there you are.
Hi, everybody. I'm Donna Nellick. I'm the Director of Prevention and Community Education at Chestnut Health Systems, and working with many of you all through our Leadership Center project on identifying some gaps and potential community solutions. Happy to be here.
Thank you. Tony?
I'm Tony Randall. I am the coordinator of the Bond County Recovery Council, which is the ROSC grant in Bond County.
Okay. Ms. Taylor?
Hi, I'm Ailey Taylor from Net Community Church and also the coordinator at the Staunton Helping Hands Center.
And thank you. And I see Ms. Bonnie.
Hi. I was with my computer. Can you see me?
I can. We're still having a little issues with the big screen. I don't know exactly what's going on here, but at least we can hear you.
Okay, so I'm Bonnie, and I'm a recovery support peer. I am just kind of here to hang out and see what all the cool stuff you guys got going on, learn things new that I can share in the Fayette County community, as well as surrounding communities. You guys are great. I'm glad I get this invitation.
Very good. And let's see. Oh, Katie, there you are. Hi, Katie.
Hey, guys. Katie McKenna from Christian County, specifically Pana, Illinois. I am working with ODAT Recovery Solutions for Christian County and surrounding counties. It's good to be here. I'm here to learn and see what I can get.
We are glad to have you. Ms. Corinne?
Hi, I'm Corinne Briscoe, the Director of Probation and Court Services in Macoupin, Greene, and Scott counties. I'm also the Drug Court Coordinator for Macoupin and Greene County Drug Court.
Very good. Patrick?
Hi, I'm Patrick. I'm from the Bond County Recovery Council. I work with Tony Randall, doing similar work to you guys. Thank you.
Okay. And did I miss anyone else?
Dane Solari.
Oh, I'm sorry, Dane. Hello?
Dane, are you on mute? I see him. Dane, are you on mute?
Yeah, I'm here. Can you hear me?
Yeah. No, I can't. Thank you, Dane.
Well, my name is Dane Solari. I'm pastor at Trinity Baptist Church in Gillespie, and just my first time being in one of these meetings with you guys. So thanks for inviting me.
Thank you. And once again, I would like to thank everyone for being here today. Is there anyone I missed, or was that it? Okay, and we will go ahead. We have a short video for you all.
Recovery from substance use disorder is a lifelong process, similar to other chronic conditions like diabetes or heart disease. In our society's relatively short history of treating substance use disorders, most of our efforts have been focused on short-term treatments provided at a point of crisis. Over the long term, effectively treating substance use disorders requires a range of personalized supports that work together to foster healthy growth and a meaningful life. This is known as a recovery-oriented system of care. For recovery to fully take root, all aspects of a person's life must be addressed. A recovery-oriented system of care encompasses the entire network of services and supports that help individuals improve health and sustain wellness. The focus of care expands beyond clinically directed models to engage the larger ecosystem of support that is community-based, person-centered, and builds on the strength and resilience of individuals, families, and communities. Recovery-oriented systems of care build partnerships and networks that increase recovery capital. This inspires positive outcomes by promoting prevention, early intervention, harm reduction, treatment, and recovery support across a person's entire life. This system recognizes that each individual is worthy of culturally relevant, comprehensive, coordinated care for their unique situation. Resources in the community are easily accessed and leveraged toward achieving each individual's goals. The central focus of a recovery-oriented system of care is to create a vibrant ecosystem of supports and resources to effectively address the full range of substance use challenges within communities, placing the person receiving support at the center of the process. This transformation of thought, policy, and practice emphasizes the hope and reality of a fruitful, long-term recovery. For more information on the benefits of a recovery-oriented system of care, visit the Peer Recovery Center of Excellence.
Okay, thank you, folks. We see.
Recovery from.
Oops, that's next month. Sorry. But we are seeing so many of you guys showing interest in what we're doing and coming that I kind of thought it'd be good to recap what a ROSC is and what we're here for in the first place. Wow, our whole leadership team's here. You met Ken, Becky's working there, and me and Jennifer. And I think at this point, we have approval of the minutes. Oh, we got our agenda. Okay. I'll tell you what, real quick announcement before we go to the approval of the minutes is starting next month. When we do introductions, if you all would like to start thinking about updates with what's going on with your organizations, when we do introductions, we'll do like a 3-minute, hey, what's going on with us, what's new, and that will start next month. The other thing is we got those 3 beautiful tables in the back, and for those online, they really are there. I'm not making it up. And if you all have anything marketing information-wise that you would like to bring to distribute, please do so. I guess at this point, I'll tell you what, we will go ahead and we send out the minutes, and I'm looking for approval of the minutes.
I second.
Okay, and all in favor? Yay! Okay, so minutes are approved. And let's see. Oh, the 3 webinars we are placing that will go out with the minutes from the meeting is we have a webinar on autism acceptance through OMSL. With us being the new time change, I thought, let's do a little webinar on helping our sleep this time of year. I'm still adapting. And there was a 3rd one. You know what? It'll be a surprise. It's in there. It's great. It's so good I couldn't even show you because we would have people banging down the door. Other things coming up is one of our organizations that is a collaborative partner is Amare. It's a recovery community organization, Wood River. They are having a trivia night coming up April 7th. And anyone willing to participate? April 21st. You can go to the Amari website and sign up. I think a group of us from up here will be coming, and you can always reach out to me if you'd like to be part of that group that would go to it. Good sober activity, lots of fun with people in recovery. Oh, we are applying for another grant. And again, a lot of you folks have been with us since we were just the consortium.
Yeah.
And but we are going for one more grant expansion. And Kent, would you like 2 minutes to explain what we're going for this time with this grant, or do you want to wait?
Well, it's kind of going after more of the same. We just haven't been funded for anything that will take us. We're trying to find sustainability through 2026. So this again probably has a lot to do with both harm reduction, prevention, treatment, and recovery services.
Very good.
And that's pretty much it. We everything we do, we're trying to be pretty comprehensive in that. And it does call for a letter of commitment from key consortium members that would like to participate and be a big part of it. And I think letters of support are welcome as well. So we'll get that out to them later.
We are going to get that out. And for some of you, I was talking beforehand about MOU, and that's a memorandum of understanding. That's different than the letter of commitment. If you come to our meetings and you like what you see, State of Illinois really likes us to basically have MOUs, which says, I come to the meeting, I like what they see, I support it. And we have hard copies, and we do send those out with the minutes also. But yes, the letter of commitment, especially for our partners that's worked with us in the past for a while now, expect to see us out the next week or two. We have about a week to get that done. It's just the nature of the way grant writing is. And then Krista, if you could give me just couple quick words on the PIMS data, because Krista is our big data person.
Yes, I'm the data person. I think we're getting close to finishing on the PIMS data, but if you haven't returned it yet, and normally you give us PIMS data, please send it in. We really appreciate it. It basically makes HRSA very happy, and if HRSA is happy, we can keep getting funding for our programs, and we can keep doing what we do. Yes, and do you need to turn in PIMS data? What is PIMS data? If you have to do it, you know. You know, it's that simple. If you don't know what it is, you probably don't need to do it. Other things is our Al-Anon meeting in Thursday night at Crossover Ministries is doing very well. 6:30 p.m. The Emotions Anonymous meeting Thursday at Beacon Church here in Litchfield is doing well. I went myself because I needed a little tune-up, and I'm not afraid to tell you that this last week, it's a great meeting. I left thinking, wow, I'm in better shape than I showed up. On those notes too, something that'll be coming down the pike is I'm facilitating, again, as the council or as the representative of the council. I don't start things myself, but I try to connect the people and try to get things that people could use in our area. And Corinne, forgive me if I'm taking a few liberties, but I'm working with probation to see if we can get some sort of 12-step AA or NA started in Carlinville. We have not had a meeting since before COVID. It shut down about the time COVID hit. And that's something we could really use. And that's an example of kind of what the ROSC does is our partners and people we work with, we talk with them, we ask them what the needs are, and then we try to connect the dots to see that it happens. And so I guess that's about it on the announcements. So at this moment, let's see how we're doing. Hey, we're pretty good on time too. I kind of recently we did a needs assessment and a community resource map in our area. It was required for a ROSC, and we got submitted. It is on the GSU ROSC website if you'd like to take a look at it. But we were identifying the needs of our area and the issues. And as we conducted these interviews from data we collected in the past, fresh interviews, people like myself with the lived experience and their family members, one of the big things that they brought up, and if you look in literature, it's pretty prevalent, is there's still a lot of stigma around the disease that we have. And everyone's entitled to their opinion, but I believe I have a chronic disease. It is under control and well managed at the moment, but there's things I have to do. the world still doesn't necessarily make you feel good about having it, you know? So something that came up a lot during these interviews is like, I heard people like me saying, there's still a lot of stigma around this stuff. And I thought, you know, that might be something that we can address. And that is one of the things the ROSC is doing, is trying to address some of those issues, educate, that's something a ROSC can do, educate the public. And so on that note, the main topic for today is, I've been very blessed through Carissa to have some graduate students from WashU work with us for over a year now. It's been, wow. And Pete, who introduced himself a little earlier today, has put together a presentation on language related to stigma, language first. And so I would like to introduce Pete and give him the floor. So thank you, everyone.
Where's the camera?
Camera's right here.
Oh, I will just say next slide, and I'll do the next slide first.
Hi, everyone. So I'm Pete. I'm actually a little bit nervous. I'm not very good at presenting, so I apologize. You know, I shouldn't lead with that, but there it is. So I have a master's in cultural studies from University of Chicago, and I also have a master's in public health from. Oh, I can take my mask off.
Yeah.
Hi, everyone. I have a mouth. I have a health degree from GW, and I'm now at WashU pursuing an MSW with a focus on clinical mental health and substance use disorders. And I have significant lived experience. I have a troubled immigrant background. I've lived all over, a lot of domestic violence, and so I was diagnosed at 19 with complex post-traumatic stress disorder, and it was treatment refractory, so it was very difficult for me. I tried everything. It pushed me to substance use, and I self-medicated for years. I ended up addicted to intravenous methamphetamine in my late 30s, and while living in the San Francisco Bay Area, and was like houseless, dependent on friends, you know, sleeping on couches. It was pretty ugly, and but you know, I'm in long-term recovery now. And part of my academic work is that I'm interested in minimizing, I'm realizing I'm reading right off it, but I'm interested in minimizing the impact of community, oh, something got cut off.
Community programs to reduce reincarceration.
Okay, well, yeah, so I'm trying to strengthen the impact of community programs, right, to reduce rates of reincarceration.
Yeah, that was my
as
edit.
Related to, that was your edit? Okay.
Yes, my fault.
But I'm also a published writer, and I know that language matters, so that's why I'm here today, is to talk to you about how language matters and how it shapes beliefs and attitudes about addiction. So I actually have a little cheat thing that I have to look at here. But this slide is basically just about health promotions and sort of the overlapping action areas that that any sort of promotional campaign should consider. And I really want to focus on 2, 3, and 4 because the work that we do in addressing shame and stigma addresses these three core components. And so, you know, it's pretty self-explanatory, but we want to create a supportive environment because recovery from an addiction or maintenance can't happen in an environment where there is shame and stigma. Shame and stigma often promotes more use. We also want to develop personal skills as professionals or clinicians in working with these populations, but also encourage people in recovery to develop those skills too, because it's only through integrating with the larger social network or a community that you know, recovery can be maintained. And then we also want to strengthen community action through awareness and outreach. And then, you know, we see the arrows trickling down. And the idea is that through changing these things, or through addressing these modules, eventually we can also address policy and affect change at the systemic level. Next slide, please. So I basically went through some of these things, but yeah, I guess that's the last slide. But I just wanted, the takeaway here is that language both shapes and upholds attitudes, beliefs, and behaviors. So if we don't address these language, we can't really address and change all the other obstacles and barriers to sustain recovery and providing care. So I know nobody likes rules. Rules are made to be broken. These are just guidelines. I should have said guidelines. But with health promotions, you want to keep it simple. In public health, they said that you have to keep messaging between a 5th to 8th grade reading level. So that's just a general good rule of thumb. And this is actually more about design in your brochures or in your promotional material. Leave enough white space. People often don't do that. They just crowd the images, or they just crowd it with text, and just make sure that people can actually read and get the information. And it's important, don't use images that might cause distress among people who are in recovery. So like, don't use a picture of somebody injecting. If this distress can be some more use. And also, there have been a lot of studies that show that fear and scare tactics is not really an effective way to promote, to discourage you. Right, so just be mindful of that. And then another important thing is to use, I'm sorry, I'm going really fast. If I'm going too fast, please. It's like, make hand gestures, slow me down.
We're gonna have questions afterwards.
I want to get that in writing later. Right. So please use person first language. So the key idea here is to focus on the person, not their illness. So rather than saying, and I do this myself, I refer to myself as a junkie or as an addict. But rather than saying somebody is an addict, we're trying to shift more towards somebody with a substance use disorder, or somebody who has experienced substance use, or someone with experience with addiction. Because you're trying to create a distance between the person's condition and who they are as a person, right? And it's hard to always think about language and how it shapes our perceptions, but this is like a really major point. Next slide. So I put together, I really hate that color yellow, but these are some considerations. Basically, it's a checklist for whatever messaging you come up with. Before you make it public, ask these questions, like do these tests. So reflect on where you're getting the information, where you're getting, like cite your sources. Also think about how the language is framing the people that you're talking about, the populations that you're talking about. Like, are you framing it as like somebody's a good guy or bad guy, right? We want to try to be neutral. And then are you being objective in communicating the information? Are you inserting your personal bias? This is going to require you to sit back and think about what your assumptions are, and how it's shaping your messaging, and how you can try to be more neutral about it. And then there's a spell reframe section where you can think of any opportunity to send out messaging is an opportunity to reshape the conversation. So that's pretty obvious, but like, how can you use language to help people change their attitudes, or to challenge or push back against negative attitudes? And then listen. Listen to as many people as you can, people from the communities, people who are in recovery, people who are stakeholders, just listen. And try to have the difficult conversations. Because it's hard. I mean, addiction recovery, substance use recovery is difficult for everyone. I mean, it's such a loaded topic. Yeah. Slide, please.
So I bet you didn't expect to have to do some work. But so part of doing this is to get everybody to help the ROSC with messaging. And so what we are, I'm guessing not everybody came with a piece of paper. Oh! But Pete has been prepared. And so we have directions here. Basically, we want you to write down It can basically be anything you want on substance abuse in terms of what you think should be messages that the ROSC communicate. And we're kind of leaving this be very open so we can just see everybody's different approaches to it. So it could be messaging, it could be what you think about substance use disorder, it can be, and essentially you're going to write 2 or 3 sentences, and then you're going to pass it to your left. And then the person next to you is going to, you know, they're basically going to add a little bit to it, they're going to take away, they're going to do a little revision. So, you know, you have to be a little bit, you know, you have to have some chutzpah to send that over. And then we're going to pass it one more time, and then we're going to go around the room and we're going to read our messages.
We're just writing down this
Aaron Hunter, please call 8780. Aaron Hunter, please call 8780.
Oh, thank God. Branding. I was afraid of that.
Need a pen, John?
Yeah, I need a pen.
And maybe for the people that are on Zoom, if you guys want to enter a chat, you could possibly do that through chat as well.
Yeah, exactly. So you could do that by chat. And granted, you can't really send it to the person on your left, but you can also look at the chats that are there, and you can do some revisions on the chats and change them and use that as a method of brainstorming.
Yeah. This is our own personal view of what we think of recovery, is that correct?
It can be what you think is recovery, but it's also if you had the choice of what kind of messages we should use
to send out
for the ROSC, yeah, for the ROSC and for the recovery in this community, this is what you should think they are. And really just use the top of your head, because what happens is other people are going to look at it and it's going to give them ideas, and it starts getting better and better that way.
It is messaging.
Yeah. And if you have a bunch of messages, put them down. If you just have one, that's fine too.
Yeah, the idea is dangerous for me. So there's an S on the end of ideas and messages. Does anyone say anything else?
Oh, we lost Wi-Fi.
Brian's computer isn't really. I don't think it's
Are we getting any chat?
Yeah,
we're watching the chat.
Yep.
It's good enough.
I would like to do that if possible.
How many times do you want us to pass these papers?
It's gonna be twice. So you have about 2 more minutes to sum up your ideas. So basically, the idea is that we take all these, we're not gonna make any decisions about what messages are going to be there, but this is something that a working group or even the consortium themselves can later wade through and make decisions about what they want to use later on. Or they have a number of different options.
Synergy.
It was amazing.
This is what we came up with
By the way.
from our psychology.
No, we're supposed to read.
I don't expect anything less.
I'm just sitting over here.
Already.
So they're just starting. He's already, he's being impatient. Okay, maybe when we get to about 1 minute.
There you go.
So you have 18 more seconds.
Sometimes it's just understanding the question.
All right, ready, set, go. Pass them to your left.
To add to that, just, you know, you trying to follow their train of thought.
You can't read it, right?
No,
Like to,
Oh, sorry.
It's all good.
Are we adding to the ones that are passed?
Yes, yes. You're building upon what the person previously passed.
So if it's more of a generalized statement, how could you break that down? Or local?
Yeah, I mean, it's basically how you would change it according to your opinion. And if you really like it, just keep it as it is. But if you want to make some changes to it, make
all the
changes to it.
money for the books, all that stuff, but then give it to them. And we know to get it.
Good stuff. Yeah, I'm sure we will.
Elaboration on what
the
other ideas are. I know you can add to that.
I'm gonna have.
I'm only passing twice because I have taken.
Just wait again.
So pretty well, I just built off of like sand.
All right, we're gonna give you 1 more minute.
Nice try.
Still not. Oh, her? Yeah, she's got nice penmanship.
All right, pass it over. If you haven't yet.
Yeah, we're already there.
We're there.
Then I feel good about it, okay. You get lots of time, okay, otherwise you got.
Yeah, we do have a lot of time.
Now we're gonna do.
Once we understood the assignment, it goes a little further.
And it's not proved anything.
That one you
I know anything.
Do you want to move it one more time, or do we want to?
I think this one's done, yeah.
Yeah, so maybe he can hold on to it, okay, yeah.
Our meeting chairs would be.
You want to switch the audience to?
Yes. You know, it'll be actually on the book, you know, on the site cover. And that's why I can be part of it. Because I'm not really, I know, like, people that enjoy the time reading that, the law.
Okay, who wants to start? Oh, not everybody jump at once.
I'm without a chair. It's like musical chairs and I didn't.
All right, I think that way. Yeah, I think we can just go around the table, so I can start. So
Somebody's got two down.
you are not alone. There is help available. You are worth it. This is just the beginning of a better life. I'm sorry. Oh, you read mine. Don't let society's stigma define you. The road to recovery is not a one-size-fits-all. There is no perfection, just embracing the hurdles of effort and moving in the right direction is all that matters.
Recovery in Macoupin and Montgomery includes all of us. We've got this, so you've got this. Bring both communities together with community building activities and build on the success of both counties. Build a RCO where we support both counties and have speakers who are in recovery speak.
Reduce stigma and educate the community on resources, activities, and trainings to strengthen our community. Have more events open to the community to try to educate them on substance use disorders, even if it is held online. Have more people who are in recovery speak out on what they've been through and have safe activities for those living in recovery.
Your past doesn't have to define who you are. I like those living in recovery with local events and dinner. Help try and teach the community that people with substance abuse disorders aren't bad people. Educate schools, organizations, be out in the community and at hometown celebrations, hold a 5K walk, run for substance abuse disorders awareness, articles in paper, look within your own network of family and friends, neighbors, and reach out to them with support and encouragement.
Reach out to organizations with material on how to develop safe community and help those with substance use disorder, community activities. Understand that people in recovery need support, encouragement, and hope.
Everybody make sure to be as loud as you can when you, because the phone has to hear you and everybody here has to hear you.
People with either substance use disorder and or mental illness need your support and understanding. Please remember to be kind and we can all learn and grow.
I don't have one if somebody's gonna. I was too ahead of the game.
I read that one.
Long-term recovery is possible. Long-term recovery is achievable. Long-term recovery is the goal. Substance use disorder, my apologies. Substance use disorder is a disease like hypertension and diabetes. One day at a time, together, every day is an opportunity together.
Aaron Hunter, please call 8798. Aaron Hunter, please call 8798.
Together it is achievable. Put aside labels and work as a group to help each other and centralize the efforts. We need
to embrace the fact that others need help with mental health and substance use, chronic diseases that can be controlled for a healthy future.
As someone in recovery, do you feel there are enough resources available for everyone in need? Are there enough programs available? You can be part of the solution for community recover. What more needs done to help informing, educating, and working with youth to reduce the risk of addiction? Addiction is so critical to community health. Involve our legislators to funding in mental health and recovery facilities. Medicated assisted treatment is helpful, especially in cancer, individual group therapy. This is doctor handwriting here.
Guess who that
Staying connected is critical for your health and recovery. Helping others in recovery can strengthen your recovery progress.
Address mental health issues that go along with substance abuse. More volunteer actions in every community, especially with local law enforcement. But it's okay to be different. Recovery is a process that needs to be known. A lot of domestic violence is involved with substance abuse. We need more awareness. Counseling in our jails and prisons for those that are still struggling. Rehab beds readily available for jails or people who come in the safe passage with no wait times for a bed. Attend local classes offered open to the public about the stigma, how recovery works, and how you have to work at it daily.
Everyone can find the strength to recovery. There is no such thing as a hopeless person. Help with treatment and recovery is available for everyone. No one is judged or denied. If you don't know there is help out there, it's our duty to make it available. Group meetings, sponsor, and especially volunteer time.
More outreach for substance abuse users, housing options for substance abuse and mental health consumers, getting rehab spot readily available for those in jails, prison, hospital settings before substance abuse consumer changes mind or is released on bond. The right nows all go clients. We need transportation to get others back and forth to the meetings or appointments. And what we are doing right now is not helping. We need a change that works, a whole community approach.
Getting the courts to help us, such as getting people who have no resource to finding a way out of addiction. We recently provided Montgomery County Jail to AA books and 10 NA books to help those in jail. If we create more resources, less judgment, and more education on addiction, we really can make great changes in our communities for everyone involved. And receiving services for substance use opposed to jail time and start educating our children at a younger age on substance use disorder.
Everyone at some point in time has dealt with addiction. Addiction affects everyone. Addiction does not discriminate. Don't be ashamed of your story. It will inspire others. Monsters hide in the dark. Speaking your truth can take the stigma away and help others know that they are not alone in their struggles.
Stop the stigma. You have the power to say, this is not how my story will end. With help and support, you can rewrite your story. We can be that help and support. It's often said, help those who are willing to help themselves, but love doesn't start there. I'm thankful for the people that helped me when I did not know how to help myself.
No matter what you're feeling in this moment, you and your life matters. You are more than ... You could be one step away from changing your life for the better. Direction can determine your destiny. Dangerous if said in different crowds, but the idea is you can change your direction. Changing the crowd you surround yourself with isn't easy, but might be necessary.
Be patient with your community as they gain the tools to help you, changing the story, one story at a time. Often what we think is the conclusion of our story is just a chapter. Our ability to meet the needs of the people in our communities is only as strong as our resources. Sobriety is only as strong as our support systems. Think beyond the here, now, and focus on long-term solutions. Don't be afraid of removing obstacles that challenge your recovery. We work together.
Routine.
Yes, right.
Oh, wow, that was fantastic, everyone. Thank you so much for that.
I'd like to.
Yeah, for sure. Yeah, well, I actually jotted down just some verbiage that kind of kept on coming up. So I'm just gonna read some of these off. It's pretty powerful stuff. I think we said chapter versus conclusion. That was absolutely beautiful. And then we had like common themes like achievable, network, encourage, connection, community, safety, hope. Housing was a major one. No jail, so like punishment, like no punishment, compassion, opportunity, embrace, yeah, connection, and process. That recovery is a process. I think all of these words, actually, just these terms, would be useful in your messaging, right? So keep in mind.
A couple, sorry.
No,
A couple that were mentioned on the chat. Reducing stigma also means conveying the message that addiction is an illness and not a choice. Recovery happens when we share our stories. And then I think it depends on the type of stigma that exists in the community. Stigma also shows up in many ways. Sometimes it's about folks knowing so little about how addiction works that they think substance abuse is a moral issue, so ... Messaging around how addiction can happen to anyone. Recovery looks different for every individual. And they think one message should be a campaign to educate the public about addiction as a chronic disease, not a moral failing.
All right, do we want to give a little bit of update on safe passages, and then do you think we have enough time then to do the moment of wellness?
We do. I'd like to start real quick. March makes 1 year ago that Kent came to me and said, there's this program up in Taylorville. I think we could use it down here. And I met with Denise Evans and Chief Wheeler, and somehow we managed it with the support of the Litchfield Police Department. And I sat through March, April, and beginning of May, we got one client. And then even through the summer, we were getting 1 or 2 at a time and not many. And everyone kept telling me, it's like, just wait till the word gets out, just wait till things. And so I waited and waited. I switched roles. Elise and Lindsay hopped in, and I'm going to leave it to them to what's happened since.
It took 2 of us to fill his position, by the way. You lost it.
So Elise and Lindsay's been doing this for several months. They can give us an update of what's happening.
And that should be February 20th.
Well, I'd like to just say that we added 3 more safe passage police departments. Bunker Hill, Brighton, and Carlinville were right on board. And we just went to Wilsonville City Council meeting, and they knew us before we walked in there. And that was a really cool feeling. And like Brian's saying, the word is really getting out, and it's exciting. We have now people asking us to come to them. Actually, one of the people that we saw in Wilsonville invited us to coffee, so we're heading there next week.
Oh, yes, and folks, at the back of the room at our marketing table, we now have safe passage signs. You're free to pick one up or 2 on your way out. We'd be happy if you display them. And for those folks online, if you want to reach out to us, we could probably get them to you too. So thank you all. And I guess at this point, Mr. Kevin Schott volunteered to do our moment of wellness today.
Yeah, thanks. And I'm hesitant to tell this story because it opens me up to stigma. But I thought this group might appreciate it. I get asked often why emergency management is concerned about groups like this and what's going on in our community. Well, it goes back, start my story back in 1960. I'm going to age myself here too. It starts back in 1968. Baseball was my life. All I wanted to do was be a Major League Baseball player. I was good at it. And in the summer of '68, my grandmother's brother and family came from Anaheim, California to visit. Cousin Jimmy was in the minor leagues, a pitcher, and with a tremendous amount of potential. So, and it was great, 11-year-old kid catching a minor league, possible major league pitcher. And as we did, we went out in the yard and I put my catcher stuff on, and he was throwing curveballs that was breaking 2 and 3 foot. It was great. He got drafted, went over to Vietnam, played baseball for the Army around Southeast Asia, got involved with drugs, and never played baseball again. I got into high school. I was into full-scale pharmaceutical research through high school. Continued that after high school. I ended up getting married, having a daughter, somewhat in that order. But I wasn't happy. Now fast forward to 1986. My father had passed away in 1985 from alcohol. So Jimmy came back. I think he was after my grandmother was in her waning years. I think he was after her money. But regardless, he came back now, a self-proclaimed entrepreneur, wine broker and an advertisement man. Truth be known, he was Coke dealer for the elite in Hollywood, and he brought the biggest bag of Coke I've ever seen. He didn't leave with that much, I will tell you that. But we were out playing golf one afternoon during that trip home, and he said, you know, as an ad man, I'd like to come up with an ad that I could get a nickel from every person in the United States, just a nickel. You know, if you do the math today, that amounts to a little over $12 million if everybody 18 and over was to give an extra nickel. He says, well, I'd have a pocket full of jingle. And I don't know if it was divine. I'm not sure. But what I heard, because I joined the fire department in 1982, and I was doing it for the kicks. To drive the fire trucks and to go into burning buildings and the adrenaline rush. I wasn't doing it for the right reasons. I was doing it for fun. And what I heard was if we could get a nickel's worth of extra effort to help humanity out, what a better world it would be. And it just, that clicked to me. The next year I joined the Air National Guard. I was 29 years old. Became a firefighter for the Air National Guard, spent 24 years in the Air National Guard. And I'm just giving my nickel's worth and hoping that I can bring a few more people along. I can't say I was ever addicted. I enjoyed my times when I was young. But I think the moral of my moment of wellness will be, we have to be very careful how we judge people for what they've done in the past. I've turned out somewhat okay. I think we need to be looking at judging people for what they're doing today. And that's my moment of wellness.
All right, thank you. Well, folks, I want to thank you all. We're almost at 3 o'clock. Do not think this exercise was for no reason. It's going to come back in the future for us. Okay? And real quick before you leave, we got Recovery Month coming up in September. I know that seems like a long way off, but it's not. As the ROSC, we can support different things that want to go on during Recovery Month. And if you have ideas that you would like trying to be done during Recovery Month, reach out to us. We're here to facilitate, try to make things happen.
Very quickly, we'll have a community risk reduction meeting the second Wednesday of the month. I'll get information out on that. We're looking at, in October, doing a symposium. We've got somewhat already lined up. The individual from Oklahoma City, if you remember back to the bombing of the Muir building, there was a picture that went around the world of a firefighter carrying a baby out of the building. He He is going to come to Litchfield. He had severe PTSD from just that incident, but also PTSD is cumulative for emergency responders. But we're also looking, and we want to talk about making it a 2 or 3 day thing and bringing some additional people in. It's going to take some money. If anybody knows of any funding sources that we could utilize, and Brian, I don't know if you want to put a committee together to work on something like that. I'd be more than happy to sit in on that, but I think it's important that we educate the public.
Very good. Thank you, Kevin. And go ahead, Dan.
So as president of the 708 board, I've got 2 members in here of that board. We are a board in Montgomery County that administers the money that's collected for the taxes that people pay in Montgomery County for mental health, substance abuse, and developmental disabilities. I heard that there's a lot of people in here, as the introductions went through, that are in recovery. You, as a person who is in recovery, I will give you my email, my phone number. You can talk to John. You can talk to Maria. Please tell us what you need out there so that these funds are not just going to fill somebody's budget, that they're actually going to programs that help with mental health, disabilities, or substance use. This past week, Montgomery County had 4 suicides, whether it was through completion or whether it was through attempted or whether it was somebody who was struggling. We don't need that number to get any higher than what it was. So I ask you folks that are in recovery, please let us know what we can do to either prevent, help, or get help to those that need it.
Can we just ask your name and email real quick?
Sure. It's Dan Huff, 66, and Huff is HOUGH @gmail.com.
What was after the hub?
66.
At Gmail?
Yeah. So Dan Huff, 66 @gmail.com. And that goes for anybody in here, whether you live in Montgomery County, Macoupin County. We'll try to do the right things. That's why we're serving on these boards.
To kind of build on what Dan just said, I did pass around an evaluation for the meeting today. Also in that comment section, please don't be shy. Just put comments, thoughts. I know we did the activity that we collected, but anything you think that relates or that could be related to recovery or mental health that we could focus on as well. If you did not get a paper, there is a link that's going to be sent to you via email for the evaluation as well. So you can do it online as well.
I just want to remind everybody that, you know, even though Lindsay and I are employed through Macoupin County Public Health, we work for all of you. So if there's any resources that you need or you're curious about a facility and what they do there, that's where Lindsay and I would come in. Or if you're dealing with a client or a person in the community that you don't really know where to go for resources, please call us. Our business cards are up here. We work with all of you. Okay.
And I can say Lindsay and Elisa are like walking encyclopedias when it comes to resources. Anytime somebody comes and says, I need help with this, I immediately go to them and say, okay, these are the 2 you want to talk to because.
Well, I was a caseworker for 7 years before, or, you know, altogether 7 years. So I've collected a lot over those years.
Yeah.
Well, thank you everyone for being here today. Feel free to stay after if you want to talk with anyone or network. And we will see you the 4th week of April, Monday, 2 p.m. Have a good day, everyone.
Thank you, everyone.
Thank you.
Oh,
And if